Welcome to Face the State. I'm Ariana Bennett. Thank you for joining us. Well, skin cancer is the most common cancer in the United States, with more than 50,000 new patients diagnosed every year. And we're heading into the time of year when your outdoor activities put your skin at greater risk. On top of that, Americans have a lot of misconceptions about healthy habits. Dr. Jennifer Janiga with Janiga MDs is here to talk about that with us. Jennifer, thank you so much for coming on the show.
Thank you for having me.
Okay, so this is the time of year we're approaching the danger zone. What do you advise your patients to do differently with their skincare this time of year?
My most important thing is sunscreen. So we live at 5,000, 4,000, 9,000 feet elevation here in either Reno or Incline or all of northern Nevada. So we have a higher UV index even at the higher altitudes than they would in Las Vegas, that's closer to sea level. So I really advise people to wear SPF greater than 35. Make sure you're reapplying every 2 to 3 hours, and definitely every 2 hours if you're near water or snow, because it reflects and increases your exposure.
Right, now that's something I was going to ask you about, this SPF thing. I feel like more than anything there are the most misconceptions about SPF, saying anything over 15 is the same. You know you have to go all the way up to 70. What's the difference?
So there are sunscreens available that are up to SPF 100. 85 to 100 I have seen. So the real answer is there is more benefit the higher you go, but it's not as incremental as the actual number. So a 30 is probably twice as much as a 15, but 100 is not 3 times as much as an SPF 30. But you do get more and more benefit the higher you go. So we do advise the highest, especially for water sports and snow activities.
Okay, so you go to the grocery store and you look at the shelf and the highest one you find there is the one you should buy?
If you can tolerate it, the most important sunscreen is the one you actually put on. So if you don't like it or it doesn't feel good for you and you're not going to wear it, then a lower SPF would be better because you would actually put it on.
Right,
Yes.
and not all sunscreens are created equally. I know the more common brands work differently from the ones that are zinc-based, correct?
Correct. So there's 2 types of sunscreens, chemical and physical blockers. The zinc and titanium are the physical blocking types, and then there are chemical blocking sunscreens also. And those are the ones that you can commonly buy at the drugstore, for example.
Is there any difference in how healthy they are for your skin? I mean, is it bad to be putting chemicals on?
So from a purist standpoint, most of those more organic or purist people would say that all chemicals would be bad. So if that is your philosophy, there are alternatives for you, and you can do a physical blocking, chemical-free sunscreen only. I will caution that they're more expensive, and a lot of people do complain that they're a little bit white and pasty if they're physical blocking only, but they are available. So if that is a concern to you, you do have a solution. The data has not panned out that there is any long-term side effects of the chemical blocking sunscreens. But the truth is, my children are going to be the first generation of children who are exposed to sunscreen from 6 months of life all the way on. So I do think that we should exercise some caution.
Yeah, it is interesting, definitely. Does everyone need to wear sunscreen, or are some people, I have a lot of friends who have naturally darker skin.
Correct.
Yeah, I tan, I get dark, I don't need a sunscreen. Do they need to wear it too?
The truth is that everyone the more pigment you have in your skin, the more protected you are. So the skin cancers that we see that are more related to sun exposure, such as basal cell and squamous cell, are much more common in people of fair skin like you or me. But melanomas and some type of pigmented basal cells and others just happen in dark-skinned patients also. So a sunburn is bad for everybody, but the people with darker skin do have more natural protection.
What about tanning? If you do tan and you stop it before a burn, is tanning in the sun healthy?
That's a controversial topic because of the vitamin D controversy. So you do get vitamin D from sun exposure, and there is data to suggest that you do get a little euphoric feeling after sun exposure, and there are some diseases that are related to lack of sun. But the reality is the more sun you have, you do get a cumulative risk to your DNA. The sun does affect the DNA in the skin, and that's where we get skin cancer long term. So the more you have, even if you don't get a sunburn, you are having a cumulative effect, which does cause skin cancer, and we do know that.
Or, even just the aging of your skin and stressing your skin, the appearance of your skin.
Correct.
Right.
Correct.
Even if you don't burn.
So I have lots of young patients who don't want to wear sunscreen, or they don't understand the long-term consequences. And I do try in those patients to tell them that if you don't understand the concept long-term of the skin cancer, at least remember that it will give you more wrinkles and more sunspots, and long-term, your skin won't look as good.
Right.
And life expectancy is pretty long now, so.
Yeah. Now, another little risk factor I came across just doing a little bit of research on this was that people don't realize sunscreen can expire.
Correct.
So if you're still using that same bottle that you've had in your, beach bag for the past 10 years,
Right.
probably time to throw it away.
I always say throw them away after 2 years, no matter what, even if they haven't expired. But the other thing to go with that is a full body application of sunscreen is about 2 ounces. Most of the sunscreen bottles that are available are 8 ounces. So in theory, for an adult man, that should be 4 applications. So if you still have sunscreen from 10 years ago in your beach bag, you're not putting enough on either.
Right. Yeah, to put that in perspective, what is that? That would be like a full shot glass, like a double shot
Right,
glass
and most
full
of them, right.
in one application.
Correct.
Which
Nobody does that.
Nobody does
Nobody does that. So err on the side of putting more on, and err on the side of reapplication.
that. Good rule of thumb.
Yes, yes.
Okay. How much burn? I mean, I know no burn is good, but is there a level of sunburn that becomes dangerous?
There are sunburns that can actually cause the skin to blister, so that in itself is dangerous, because anytime you open the skin with a blister, it's not only painful, but you do increase your risk of having a superficial infection.
Now, are we talking about just peeling, like a burn
You
that
can
peels?
actually blister the skin from a regular
Okay,
sunburn.
so worse than that.
Yes.
Okay.
So first you would get to a peeling sunburn. So first would be redness, then would be the peeling, and then you can actually burn it enough to cause a physical blister.
Oh my goodness.
So those itself can be
Uncomfortable.
dangerous. Right.
But peeling, bad too, right?
Peeling's bad too.
Yeah.
Yes.
Try to avoid that just in general. Okay. If people notice strange spots, I know it's pretty common to see something and be like, oh gosh, what is that?
Right.
What do people look for in terms of signs of a cancerous spot
Right.
versus not?
So even 25 years ago, the dermatologists and the American Academy of Dermatology have been talking about the ABCDs of melanoma. But I like to expand that to the ABCDEs, and you can use it for all types of skin cancer. So A is for asymmetry. If you fold it in half and it doesn't match on each side, then that's something to have checked. B is for borders if they're jagged or irregular. C is for color if there's more than one color. D is for diameter if it's bigger than a pencil head eraser. And E is my favorite, and it applies to all types of skin cancer, not just melanoma. E is for evolution. Evolution means it's changing. If something is changing, it should be evaluated. We're not supposed to have things that grow or change. If you felt a liver that was growing, or you would want to have that evaluated too. So it's the same concept.
Right. Now, spots can come and go naturally, and they're not necessarily all dangerous.
Correct.
Okay.
Right. So your body's immune system does a very good job of fighting off all kinds of cancers, including skin cancers. So if you have a spot that's very small and it comes and it's scaly and it goes away, then your body has probably fought that one off. So the good thing to remember is if it sticks around, make your appointment. The average wait for a dermatologist in northern Nevada is significant. We have a shortage. It's over 8 weeks for most people.
Right.
So make the appointment. By the time your appointment comes, you're going to know whether it is staying or gone away already.
Right. You
And
can always cancel the appointment.
you can always cancel, and somebody else, I'm sure, will need that appointment. So,
Are there danger zones, any parts of the body that are more prone to cancerous spots than others?
so the sun exposure related skin cancers, basal cell and squamous cell carcinoma, occur almost exclusively on sun exposed surfaces, such as the top of the arms, the face, and the V of the chest. But they can occur anywhere. And for men, the most common place for melanoma, which is the dangerous skin cancer, is the back, upper back. And women, it is the back of the legs. It's always surprising how many people are shocked when I look at the back of their legs on a skin exam. And I try to tell everybody, for women especially, that you have to look. No one's looking at their back, but it's the two most common places. For men, it's the upper, and for women, it's the legs.
Yeah, find a friend, have them look.
Right, have the find a friend.
We have about a minute left. Is there anything else you want to say? Any tip that you just wish people knew, or a myth you'd like to dispel?
Most importantly, I don't think that I don't think that anything that you do in moderation is bad for you. So if you have a little sun exposure, if you are a biker, if you go out, I think that's great. We live in Reno, and it's a great place to experience outdoor activities. But moderation is good. Avoid the sunniest parts of the days, and wear sun protective clothing and hats if you can, in addition to your sunscreen.
Yeah, even better than sunscreen is clothing.
Correct.
Right?
Correct.
Correct. Sunglasses, and the whole shebang.
Correct.
Maybe just double up.
Double up if you can. Go in a paper sack if you can, all the way down, head to toe.
Yeah, same thing with kids too, especially more sensitive skin on babies.
Their skin is thinner, so you do have to be very careful with them, and the sun shirts are great for children.
Yeah, okay, good to know. Thank you so much.
Yeah,
I really
you're
appreciate
welcome.
your time.
Thanks for
coming on the
having
show.
me. That's right.
All righty, coming up on Face the State, our drought is taking a major toll on northern Nevada farmers and the things they grow. Now we'll ask two experts what local farmers can change to stay afloat right after the break.